Please state your name, position, title, and institution.
I'm Audrey Odom-John at Washington University in St. Louis. I'm Associate Professor of Pediatrics and of Molecular Microbiology, and I'm also our Program Director in Pediatric Infectious Diseases and the Associate Program Director of the Medical Scientist Training Program.
Please state the year you completed your fellowship training.
I completed fellowship training in 2008.
Can you let us know why you chose PID?
So I chose Pediatric Infectious Diseases. Well, really it chose me. So when I was 18, the summer after my freshman year of college, I was working in an infectious diseases lab, and I completely fell in love with research through my undergraduate research experience and was really sort of definitely going to do infectious diseases. And then during my medical school years, I found that I just loved the pediatric side of things. And so I was really, the imprinting happened very early on, and so I was always going to end up in infectious diseases research and loved the pediatrics.
Please provide your research proposal topic supported by the PIDS Fellowship Awards Program, and how many years were supported by the award?
I was supported by my PIDS grant for 1 year because I got it when I was a second-year fellow, and my proposal was on a particular metabolic pathway of the malaria parasite, Plasmodium falciparum.
How did the award impact your career in PID?
So without exaggerating too much, I am not entirely certain everything would have come together perfectly without the PIDS award. So when I was finishing my fellowship, I was actually the sole breadwinner for the family of 4 in a high cost of living area, and I wasn't really sure that the timing was going to work out for me to get a job and actually be able to stay in science and in pediatric infectious diseases research. And PIDS really bridged that gap for me perfectly and gave me a lot of confidence that I was going to be able to.
Describe how what you do improves children's lives or patient care.
So, as you probably know, malaria is still a major global health problem worldwide, and the most affected individuals are children under the age of 5. And there are 2 big needs in the malaria field, new antimalarials and new ways to diagnose the parasite infection. So there's widespread resistance to currently available antimalarials, and the parasite has also stopped making the protein that's detected by most malaria diagnostic tests. So we really have 2 different areas of research that are focused on those big needs. So we've developed several small molecules that are very potent inhibitors of parasite growth and actually can cure malaria in mice. And recently we have been looking at non-invasive ways to diagnose malaria, and we've actually found that there are compounds present in the breath of children with uncomplicated malaria that we think we could use ultimately as a non-invasive breathalyzer test for malaria. So I think that would have huge impact if we can take it forward.